Okay, well, good morning, good afternoon. I'm excited to introduce a real life vitamin D hero, in my opinion, Dr. David Berger or Dr. David. Welcome today. So tell us a little bit about who you are.
Okay, so I'm a board certified pediatrician in Tampa, Florida. I have my own practice called Holistic Family Care, Holistic Pediatrics and Family Care. I started off as holistic pediatrics, and as the parents and then the grandparents started asking if I would be their doctor too, of which I was like, but I'm not an adult doctor. And they said, yeah, but we like you and we like the way you treat our kids and we like the approach that you're taking. We want you to run these types of tests. Can you check our vitamin D level? Can you check our zinc level? And so I said, yes, as long as I'm allowed to pull the pediatric card and say, I don't know the answer to that one, but we'll look together and we'll try and find it out. So we went from holistic pediatrics to holistic pediatrics and family care about 10, 12 years ago to kind of expand that. And now I have two pediatric nurse practitioners and two family medicine nurse practitioners and a family medicine PA who all work here. And so I kind of get the adults over to the other side.
That's great. So you mentioned vitamin D, and of course, that's one of the main reasons we're here. So take me back to when vitamin D first made it into your radar. What grabbed your attention about vitamin D, and why has it become so central to your practice now?
Yeah, so I'm gonna guess going back 20-ish years, or so. A family, which most of what I've learned has been something of a parent brought to my attention. And it was a kid who was dealing with some allergy problems, and the mom had presented me with a paper that talked about how vitamin D levels need to be significantly higher than even the reference range of 30, um, in order to have more than a bone effect. If you wanted to have an immunological effect on somebody, if you wanted to reduce inflammation, really getting the level closer to 70. And I'm like, well, if reference range is 30 to 100, why would anybody have a problem with 70? Like that's right in the middle of it. So, and then so we did it, and I actually, well, I got a vitamin D level on my kid, and it was low. And there was a paper, and I forget which one it was. One was on diabetes, one was on allergies and asthma, of which showed that low levels were significantly associated with more likelihood of catching those diseases. And one of my very dear friends from preschool, who's also a pediatrician here in Florida, Lee, he's somebody who can read papers better than me. Like research papers. He has a little bit more knowledge there, and so whenever there's something that I want to bounce something off of, I send it to Lee. I'm like, what are your thoughts? And he said it's a really, really good study, but one's in Toronto and one's in Pittsburgh, and like we're in the Sunshine State. So are you sure that this is a problem here? And I said to him, well, the first few people I checked who are kind of more holistic families who spend more time outside, and they've been low. But I said, what I'm going to do is for the next 3 months, anybody who comes in for any blood draw whatsoever, I'm going to ask if I can also get a vitamin D level. And we ended up with 72. There were only two people out of the entire, I'm sorry, four out of the whole 72 had levels above 50. The average was probably around 30. Mine was the lowest out of the 72 at 16. And so I'm like, okay, well, obviously Sunshine State's not covering us. And so that's when I started just trying to get everybody up to that level of 70. And for my own self, when I added 5,000, I think I got myself to a grand total of 30-ish. And then I bumped it to 10,000. Then I got myself up into the 50s, and I took 15,000 units, and I got myself up to the 70s. And then I said, okay, well, and I was doing it because I had allergies and asthma and eczema since I was like 5 years old. And I was on some form of medicine for like 30 years. So when I got my levels up, I said, okay, it's go time. So let's see. And so corn was actually my trigger. I had actually done an elimination diet, and corn was my trigger. And over the 10 years, as long as I kept corn out of my diet, it was fine. But 4 times over those years, I accidentally had something with corn in it. And every time throat started to close, my tongue started to tingle, the breathing there. And I'm like, okay, well, let's see what you accomplish. And so that first day I took one piece of popcorn and had that, and no problem. And then the next day I had 2 pieces of popcorn, and then I went to 4 pieces, and every day. And soon enough, I'm like, I'm eating a whole bag of popcorn, and I am doing fine. And then I started, okay, let's have some tortilla chips. So yeah, so I looked at it, and the way I've always seen it, I don't look at food allergies and allergies as a whole as the diagnosis, I mean, it is a diagnosis itself, but it's not the problem. It's a symptom. And I look at vitamin D deficiency and the other stuff that I do when I'm looking for leaky gut and other things that can throw the immune system into a hyperinflammatory state. So I look at it that my actual diagnosis was a vitamin D deficiency, and my symptom was allergies, and got my vitamin D level good. And to this day, I mean, it's been like probably 15 years. And I mean, I take my inhaler before I work out just so I get a better workout. And once a year when we do our spring cleaning, I get all dusted up and I have problems with allergies for a day then. But short of that, I mean, I don't have allergies and asthma problems anymore. And nothing I did differently, was just the vitamin D. That was the only thing that I did different.
Wow, wow. And you mentioned 5,000 didn't quite get you where you needed to be. So how much do you take now?
So I got up to 15,000. I lowered it at 10,000, and I hold still at 10,000, and that's keeping me right in the 65 to 75 range.
Okay. And have you noticed in your practice the wide variation in dose response? How I would assume some might get into that 70 range just fine with 5,000. Do you see kind of
I'm not. I'm
okay.
finding the overwhelming majority of people, because when I was first taught it, it was taught to me, give 1,000 units of vitamin D of D3 for every 10 points you want to increase the level. That has not been what I've seen. It's less than that. Sometimes it's only 3 to 5 points boost. So, but I check, so I keep on going every now and then. I mean, I just got a patient who I just started on 5,000. His level is 131, so I'm gonna have to contact the family. We have to lower this. But we know it's not really a dangerous level, since we know under 200 is seemingly okay, but there's no point in having it. So, I don't even keep people in the 90s. I'll typically lower down to like into the 70s to where I aim for. But yeah, but it's rare that I see a vitamin D level above 40. I'll see 30s.
Without
Unless there's
supplementation.
without supplementing. And like, I mean, it's incredibly rare for me to see in the above 50 without supplementation.
Hmm. Okay. And
Almost
have
never.
you ever had a case of toxicity?
Never.
Yeah.
But also, I'm checking everybody. So I mean, the responsible thing to do is you test, treat, retest, and
Mhm.
alter. Right. So I would never, even though I have somebody who's in the 20s where I'm like, you're probably needing 10 to 15,000, I would never do that to them. I may give them a little week boost where I'll say, like, let's do 25,000 units a day for a week daily, and then we'll lower it down to 5,000, just to give you a little oomph, just kind of get you over that hump, since we know it to take a long time to kind of get the vitamin D to stabilize. So I'll give a boost, but I
Mhm.
won't keep them there. So, but yeah, I never would make a jump of more than 5,000 without testing.
Right. Yeah. Smart.
Yeah.
And does that target change based on age, based on life stage? I know that you've also started treating a lot of pregnant women, but we'll get there in a moment. I would love to know how does your view of vitamin D in terms of protocol, does it change at all? Uh,
I mean, I certainly, on younger kids, I'm a little more conservative with how I'm doing, but I mean, if I have a 1 year old who's got a low level, I'll put him on 3,000 units with no hesitancy whatsoever. And if it's low, I'll go that. But so I don't know that I would put a 1 year old starting right on 5,000 units, but I'll definitely put them on 3,000 units. It's my protocol. And I realize that I have the advantage over other physicians in that I've done so much testing for vitamin D. And so I have a really keen sense of like what I can get away with and not overdo it with somebody. And I mean, like, I've had doctors who have like gone off on patients, you're taking how much vitamin D3? And of which my response is, I don't know that you're asking the right question. Because your question is supposed to be, what's your vitamin D level? Right? It doesn't matter to me how much vitamin D a person takes. It's all about getting the level right. And I know if I'm in range, I know I'm okay. Certainly, if I'm bumping to the upper echelons of the vitamin D range, wanting to make sure that they have a good vitamin D level. I mean, vitamin K is going as well, especially if it's an older person. I don't know how necessary it is for the youngest of people. I'm not worried about artery clogging and calcification so early on, but but that's what I'm like. And I've seen other doctors reply to a patient of like freaking out for those kind of levels. I'm like, yeah, but did they know that we didn't start at that dose? We worked it up, that we checked it, we worked it in. and by the way, do they acknowledge that your kid's doing better? That's
Yeah,
something to do, you know.
exactly.
Yeah.
And that's something we can just touch on a little bit later. But what are some of the outcomes that you've noticed among your patients with the vitamin D?
So I'd probably say the two biggest things I would certainly say are people who have hyperactive immune systems, um, whether it's in the autoimmune realm or other types of hyperinflammatory, which is allergies, asthma, eczema. But this is what one of the so interesting things about it is it also so often stops the recurring illnesses, the recurring ear infections, the recurring colds for the little ones, which is fascinating because getting the vitamin D level here helps people who are hyper-inflammatory and those who are maybe hypoimmune and more prone to things. Because it's the other thing I see all the time is when I get the vitamin D level, the kids don't get sick anymore, and obviously there's other things involved in terms of foods and leaky gut types of things like that. But that's like one of the most amazing things is it kind of treats both ends of that immunological spectrum, for lack of a better term. So,
Yeah,
I
yeah.
can't think, and I do put zinc in the same category as the vitamin D. I tell my patients the first time if you start dreaming or speak or like sleep talking like the words vitamin D and zinc, let your partner know it's because you hang out with me too much. But but it's just one of those things that between the two of those things, like this is how much better immune regulation occurs with those two things.
Yeah. Well,
Yeah.
makes sense to me, right? Too many people are not aware of this important information. So once again, I thank you for sharing this. And
Yeah.
I know
And,
some
and
of
I'll
it
also see a
is
doctor if they see the other doctor first and they'll put them like on 400 units or 800 units, 1,000 units. I'm like, if you're going to be playing that game and poking your kid every time, we're going to be doing this for the next 23 years before you get to good level. So let's
well,
not do it, that doctor. Well intentioned. I'm glad they at least know how to spell vitamin D, so that's good. But yeah.
and that's unfortunately why a lot of people think that vitamin D testing is unnecessary because they test the vitamin D only to give 800, maybe 1,000 IU a day, and they don't notice enough of a difference with the retesting. So, it's a
Yeah.
very, very
A
good
lot of
point to make.
ignorance out there.
Yeah, yeah. So I know a lot of this is just observational, but I'd love to share or have you share some of your experiences with outcomes and prenatal vitamin D.
All right. So let's take a step back. Okay. I check every human being who comes into my office the first time for vitamin D. Okay. If except for if you're under a year of age. So at a year of age, since I typically, I'll give vitamin D day one. So I mean, like they're getting 500 units of vitamin D. I'm like, you can cut the cord first, and then we'll start the vitamin D. But it's within the first week, everybody's on it. And but if I do have a kid who is maybe showing some atopic stuff, I'll even bump it up to 1,000. But I usually don't, and if I'm getting closer to 9 months, sure. If I'm gonna poke the kid, I don't mind getting it sooner. But everybody, since we normally check for like anemia and for lead at a year of age, of which I also get iron levels, because I'll explain just because you're not anemic doesn't mean that your iron stores aren't about to crater. You can get a ferritin level and other iron levels to see that, and that you don't have to be anemic to be iron deficient. The anemia is the end part of that. But I check everybody's vitamin D and zinc levels at the same time, and I check everybody's MTHFR through a panel a methylation panel that I do called Maximize Genetics. It's called Max Function, and that's my core 1-year-old lab test, and I take whatever it takes to get all of those levels normalized. And then anybody who comes in for any other reason, that's the first. If you're over 1 year old, the first appointment you have vitamin D ordered and reordered and followed. And then I will typically check, every year to 2 years. If I have somebody who's been stable on a good dose for a couple years, I may not check it every 2 years, but I want to make sure that I'm not going to be satisfied with getting a good level and then being done with it. I'm going to still, even if they're good and I'm staying on a set dose, I'm still going to check it a year later just to make sure that it's holding.
And since we're on the topic now, what other is that pretty much the basis of your functional lab testing? Do you ever do, because I know that you are also keen on the microbiome, do you ever test for the gut health? Do
Oh,
you ever do a
absolutely.
blood test for food allergies? And what are your other favorite tests since
Yes.
we're on the
Okay.
topic?
So I don't just check everybody. If I have a kid who's been breastfed and who's never been on antibiotics and they're eating healthy, low ultra processed foods, eating omega-3 fatty acids, whole food, types of stuff. I'm not checking everybody's microbiome. If I got a good looking poop and they have really no setup, and thankfully, we've trained our parents, or educated our parents, I should say, about healthy water, and so like the average person that I talk to at least are using a filter, but I'd say half families are already using reverse osmosis as an example. And they're already know to avoid the ultra processed foods and the plastic. So to a certain extent, I'm preaching to a choir who's already singing, for some families, especially those who are born into my practice who come to me early. The families who transfer into my practice because they have some kind of health issue going on already, and they either don't want medication, they've exhausted the medications, they were told about what I do, or just you need to take a functional medicine approach. Those are the ones that are not necessary. But that's the first thing I'm talking about: how you filtering your water, what kind of how is your air, do you know where your mold is, do you know getting everybody off of plastics, stainless steel or glass. Glass sometimes if it's a little kid, but stainless steel, you do almost everything. Avoiding the forever chemicals, making sure that they're not using Teflon or something like that. They're using cast iron or a ceramic or something that can be done well. Explaining to them that it's not just the plastics and the microplastics, and not just the BPA, because there's a great marketing thing. They say like BPA free, but it's still hard plastic, and there's other problems that are causing this, and let alone the phthalates that are the plastic softeners. So we talked about that. We talked about organic eating and the clean 15 dirty dozen, in order to know like which of the produce foods that you really should not be eating if they're not organic, whereas some of them are okay. So if you're going out to a restaurant, maybe pull your little clean 15 dirty dozen list out and see what you want to order off the menu that way. But so there's so many of those things that we're also all doing. And then as far as the microbiome, but anybody who comes in with any kind of special issue, whether it's again neurodevelopmental issues, atopic hyperinflammatory conditions, or mental health issues, I'm checking their microbiome. I'm doing a stool test that'll look both under the microscope and under the culture to see what's there. If they have a lot of issues, and of course, an important question is, what's the poop look like? And kids always love this question, because they always think he's talking about poop's the funniest thing in the world. And but what do you mean? What does my poop look? I don't look. I'm like, we all look. Come on. And I'm like, well, what do you mean? I'm like, are you passing a log? Does it look like a sausage? Or does it look like something else? I mean, what do you like? Does it look like oatmeal? Does it look like soft serve? Does it look like peanut butter? Does it look like pea soup? I do say that before I retire, I'm going to make a coffee table book that the poop picture will be here and the food picture will be here. You can just like flip through to see like which one that you have. And I don't know if more than 7 people will buy it, but it'll be great personal satisfaction to know that I did that. But it tells me so much, I mean, if you're not pooping every day, a nice log, and again, if it's a 2 days worth every 2 days, okay, I'll get with that. But if you're not doing that, then something is not right. And so it's either what you're eating or it's the microbiome. So for any of those types of things, I'll check both. Again, a test where they look under the microscope in the culture. I also do a urine organic acid test. I mostly use the laboratory called Mosaic Labs, which used to be Great Plains Laboratory. That I really like the organic acid test because there's 9 different substances made by yeast and 5 by also pathological bacteria, especially Clostridia bacteria. And those could be issues for both leaky gut problems, where there's increased intestinal permeability, but it also, certain yeast and bacteria make toxins that can directly affect the brain. In fact, if you said to me, what is the single best treatment that I've seen help the most kids with autism over the past 25 years? It's actually antifungal therapy. It's the single most thing that and the most wows that I get. Like when I see them back 6 weeks later, I get a new kid. And so to me that's a super important thing. But of course, what are we doing? We're trying to avoid antibiotics as much as possible. I mean, we know that 70% of antibiotics written for children in America were unnecessary. They were almost always viruses. There's no reason for it. I encourage families to say that if somebody writes you an antibiotic and it's not clear because you have a UTI or you have strep throat, but they write an antibiotic, ask the provider this following question: why do you think my kid has a bacteria and not a virus? And they need to have some good justification for that. Okay. And if they don't, but that's why we always tell all of my patients, if you get seen on the ER or you're on vacation somewhere, if somebody writes a prescription for an antibiotic, unless it's a life or death situation, call first and let's talk about whether that was really necessary in the first place. But we know steroids, but also, making sure people are eating good amounts of fermented foods. not just yogurts, but are we getting our kefirs and our sauerkrauts, our kombuchas, and all, kimchi's in and all that stuff. But but when introducing baby foods at 6 months of age, I'm doing that as part of first foods. So I'm getting things set right from the beginning, by obviously avoiding ultra processed foods, and we know all that stuff. I mean, it seems as if even, the mainstream medical community has pretty much identified the reason why colon cancer has like dropped from a disease of the 50s to a disease starting in the 40s is because ultra processed foods. I mean, this is kind of like a mainstream concept now, right? And so, so I would never say it's just the vitamin D. It's hugely important. It's one of the first things I want to tackle. In fact, when I put together a long protocol for people, because we have all these abnormalities, I always say start the vitamin D first. That's the first thing I want to do, in part because, as I said, it does take a few months to get the levels up there, and I want to get it up there as soon as possible, and everything's going to work better that way. But I'm also recognizing, compared to the general population, even in my general practice, I mean, almost every one of my patients is breastfeeding. Almost everybody past a year, if not 2 years. So, and again, everybody's eating right and doing all these other things. So it's not like I can take any one nutrient or any one avoidance and say, this is the reason why my practice is so much healthier than all of the other practices out there. I mean, ear infections, it's incredibly rare for any of our kids to get ear infections. It's like most pediatricians think it's a rite of passage. And if you've had less than 3, that's great. No, if you've had more than 1, that's not okay, for that. So, there's so much to how we approach things. But I mean, our numbers do stand for ourselves. I've never had a kid that I'm aware of that has had leukemia. Autism right now, the number is 1 in 36 in the country in terms of the chance of a child developing autism. In our practice, it's about 1 in 300, 1 in 400, which means, yeah, obviously, if you do the numbers, we've seemed to have reduced the incidence of autism by 90% in our practice, which is almost like an impossible number for most people to wrap their heads around. But
Right.
it's like I've seen several over the last 20 years, like literally. It's not like in most doctors' offices, it seems like once a month someone will be popping off.
Mhm.
So but we don't see the allergies. We don't see much eczema. If we do, we can take care of it. So I kind of tell people, at least in my primary care practice, I probably have the most boring primary care practice in the world, and I love it. It's great to have boring for that thing. I don't need people getting sick. I'd rather spend time with them during checkups, educating them on all of these things so that they don't have to come back for a sick visit because they don't get sick that often.
And that should be the goal.
Right. You think?
Right.
Yeah.
So it's pretty interesting when you make that connection between the overuse of antibiotics, and of course that messes with the balance of the microbiome, kills off both the bad and the good bacteria, makes it a lot easier for the fungus and the yeast to take over, and
Yeah.
and then
But
it's
if you're lacking the good guys, bad guys are going to show up.
And it is fascinating that, maybe you say it this way to your kids, but all these bad bacteria, all the bad fungi, they poop too, right? They poop too, and that poop can get into your brain, and that can,
Yeah.
as you said, affect
Yeah.
the
I
mental.
haven't said that to kids because I don't want the kids to think that something's pooping inside of them because they're freaked out by poop enough anyways. But I do say I will say, things that are hurtful. Yeah, I think if I told enough kids that something was pooping inside their body, I'd probably have someone like end up in an ER or a panic attack somewhere.
Okay, never mind then.
Yeah.
Um, Tell me more about the prenatal patients in your practice. And I want you to share the outcomes that you have with the women and the babies, because that's the beginning of life, and you're affecting not just you're helping them have a great start, but you're setting them up for a better lifetime too. So
Yeah. So going back 25 years now, those families who then said, "Hey, can you treat me this way?" Part of it was, "Hey, we never thought we would have another kid because this one's been such a challenge to deal with, but my kid with autism is getting better now, and we're ready to have another kid, but we're scared. We're scared of doing this again. So that's why we want to do these tests." And my so I came up with the idea of something called preconception to infancy, which we shortened to P2I. And the idea is looking at the 1,300 days, including the time before, a year before pregnancy up until, past the infancy age, in order to realize, hey, if we can clean people up before they even have a bun in the oven, if you will, whole grain, gluten free, but that we start life off well. And if mom's not putting toxins into the umbilical cord to the baby, then that's obviously would be helpful. And so that's how it kind of got started. And even to the point where of those particular families, now nationally, there, if you have a one child with autism, the chance of having another one is about 1 in 5. Okay. I think we've had 2 in 20 years. So again, we're not even in that higher risk population. We're not seeing it, by doing all of these things. So we, so again, a lot of the same things that we're talking about are the things that I do and then support them. But I also, as part of my prenatal care, I'm following their thyroid hormones and making sure their iron levels are good. But I also meet with all the families as they head into the third trimester to talk about birth plans and what kind of birth do you want to have. Granted, a lot of my families do. I have a fair number of people who are midwifery birth, birthing centers, home birth, but a lot of people are hospital birth. I will say, at least in the Tampa area compared to 10 years ago, these hospitals and the nurses have gotten so much better in our line of thinking about things. It's just like the type of pushback that people would get. They're not getting that kind of pushback like they used to get. But obviously, I want to talk to them about things like how do you avoid a C-section, right? Don't get induced just because the doctor needs to golf the next day and they want to make sure that they're going to get you out beforehand. But I talk about things like hypnobirthing as a self-hypnosis way to handle so that you don't need to get the pain medications, and the epidurals and all of that stuff. I talk about perineal massage, which is vaginal stretching to, especially for a first-time mom. Let's face it, something a lot bigger is going to come through there than anything ever went through there before. So how do we stretch out those tissues to make it a easier passage to get through? How do we, talking about everything from, having the best birthing situations, and some people want a water birth or ball birth or stand in, can we walk around? So I review birth plans with everybody too, so that way they're there. I'll say make up like 7 copies, put one on the chart, hand one to every doctor, nurse who walks into the room. If the custodian will take one, give it to the custodian, put one on the front of the door, put it on the back of the door. Everybody knows what you want to do, how you want to have your birth. And then I'm a huge advocate of breastfeeding because let's face it, and in fact, it's kind of funny because the World Health Organization declared baby formula is an ultra processed food, right? Which is a pretty ballsy thing to say, right? I mean, it's true, but I mean, that's kind of like for an organization like to say that. So the importance of breastfeeding. And of course, that means we need to maintain mom's vitamin D levels and zinc levels and everything else like that during their lactational period as well. But you know what we end up doing? We're teaching these women, who of course are then teaching their husbands usually and teaching the kids, how to live healthy forever of their life. So the way I look at it is like, when is the most likely time that a woman is going to take her nutrition and her health seriously? The day she finds out she's pregnant, or if she's trying and wants ahead of time to do a family plan, the day that they decide they're going to get pregnant. Everything changes because my experience, while a woman may not do to take care of herself the day that she's pregnant, everything is just like, okay, everything's got to clean up now. So it's kind of like you have a nice captive audience to promote these types of things, which is why these things need to be brought into the health classes in high school, right? Let's face it, there's teen pregnancies happening. We should be teaching them about vitamin D before that happens, getting them taken care of. So by having all of that done, and then of course, it's not like most families are going to come back to like, okay, yeah, I didn't drink soda for 3 years, but gee, I'm going to go back to it right now. So it's kind of like getting everybody set for the rest of their life, which is really cool.
Yeah. And you've noticed not just lower numbers of autism and allergies and recurrent infections, but even, I think you mentioned preterm births and other prenatal complications. And
Yeah. In fact, a fascinating thing, not necessarily vitamin D, but so P2I is now an international organization. It's been endorsed by the International Federation of OBGYNs. There are lots of other organizations that are getting on board with this now. In fact, the medical director for P2I is the immediate past president of the International Federation of OBGYNs, Jean Conroy, who is also a past president of the American College of OBGYNs. And her partner in crime on the OB world, he is he's the chair of like toxins during pregnancy, as well as the liaison with the Academy of Pediatrics in that same committee. And then our third doctor, Jose Cordero, he was an assistant surgeon general for the U.S. He's from Puerto Rico, and his research has been about toxins and pregnancy. And so one of the things that he presented, I know that you were there for this, which was startling. So in America, the chances of having a preterm birth is 1 in 10, which is way too much and not what I see in my practice, but way too much. In Puerto Rico, it's 20%, 1 in 5. And so what he did over a period of time is he actually had all these women pee in a cup to see what toxins they had, and gave them handouts and to teach them ways of how to lower their toxicity. First thing they found out, within 2 weeks of doing that, the toxin in the urinal levels plummeted. Then they went forward and found that actually within 5 years of doing this, the chances of having a preterm birth in Puerto Rico went from 20% down to the national average of 10%. Just by doing that, right? And they weren't even doing the vitamin D. They weren't even doing the other stuff. It was just by minimizing toxicity. Right now, for me, because again, we talk so much about of decrease in toxicity, and so I come in more with the vitamin D and the gut microbiome and all of that stuff like that. So, kind of putting that all together is kind of how it goes. And the reason why we call it from preconception to infancy is again to drive home how important that first year after afterlife after birth of is maintaining all of those things when brains are developing and organs are developing and immune systems are developing. So, and again, part of it, of course, it's not like anybody say, okay, now you're 1 year old. I know I fed you healthy for a year, but we're gonna feed you cruddy. And we're gonna increase the Pop-Tarts for you because you're a 1 now and you're good enough. So of course that doesn't happen.
Well, and then, going back to the preconception too,
Yeah.
yes, there's more motivation when you find out you're pregnant, but you often don't find out until what, like week 6, week 8,
Right. Yeah. And that's
and
why we need to check beforehand. Yeah.
and your lungs already begin developing when? Around week.
Well, I mean, organs will during that first trimester, different organs will do that. Obviously, most lungs themselves, the tissues are kind of developing, but they're not truly developed until the baby takes their first breath of life, right? Because there's no until lungs have been oxygenating. Other things like the liver, the heart are obviously functioning during pregnancy,
Mhm.
but the lungs are dormant until the first breath of life, and then the circulation changes over. So for lungs, they're a little bit different, but we
Mhm.
obviously know heartbeats can be happening much earlier, and we know that the liver's obviously serving, again, it's prenatal, it's immature, but the organs are certainly developing early on. So yeah, so I
Yeah.
mean, like, I will take obviously I'll take a family, a woman at any point that I can get them,
Mhm.
right? And obviously, even if you don't catch them till they're in my office for the first time for their 2-week checkup, I still have a lifetime of this kid ahead of me where I can be focusing on all of these things. And still it's
Yeah.
cumulative. And as we said, especially if these things can normalize, if you just know what you're doing there's no point that's too late.
Yeah, exactly. But it's also, the sooner the better,
Of course.
because all those tissues start developing early, and vitamin D is absolutely necessary for a lot of that development.
For sure.
And it even helps increase the chances of pregnancy. It helps
Yeah.
with fertility.
Yeah.
And so, okay, thank you for sharing all of that. I'm curious now, how can somebody find another doctor like you in their area?
Okay. Well, first of all, finding somebody who's a pediatrician, okay, there's not many of us, quite frankly. I mean, we're training them, the MAPS, which is the Medical Academy of Pediatric Special Needs. And there are some providers in there who are not just doing special needs work, they're doing primary care. That's another thing that's kind of unique because I do functional medicine specialty care, but we're also full primary care. We do sick visits and we and checkups and things like that. So I don't know that there's more than a half a dozen to a dozen throughout the country who are doing it at our level, so that's a little bit difficult. Okay. But certainly, doing a search for functional medicine pediatrics and seeing what pops up. There are going to be just some functional medicine family med doctors or even internal medicine doctors who are willing to see kids. I mean, obviously recognize they're not just little adults, but it's a challenge. But part of the reason why we are wanting to make P2I an international movement, part of the reason why we have created a P2I seal of approval for products and certifications for providers is so that people can find us and can find the clean products. Like one of the things that I know that about, even in terms of prenatal vitamins. So the International Federation of OBGYNs, FIGU, which Dr. Conroy was the the leader in this study, they went out and I think they grabbed 27 national prenatal vitamins to check them both for accuracy in the label that it had the nutrients it was supposed to, and to look for toxins, whether it's pesticides, whether it's um, organophosphates and phthalates and all of heavy metals, all of these things. Of those, all but one failed. They either had toxins in them or they didn't have the nutrients in the label. There was one that didn't even have folic acid in it, which is like, that's why you take a prenatal vitamin. If nothing else, it's for folic acid, spina bifida. The only one that passed was actually one that I helped create about 15, 20 years ago from a company called Kirkman Labs. And it came about that I helped to do that because I was doing detoxing on autistic kids. And all of a sudden, over the course of a month, 3 different kids started peeing out a very unusual heavy metal called antimony. Most people have never even heard of it. And I looked, and the only common product they had was a liquid zinc from this company, Kirkman. I asked them to check it, and it turns out it wasn't even in the zinc. It was in the stevia that was in the sweetener of it. And then they went and they checked all of the other raw materials coming to them. And they found that 60% of the raw materials had at least one toxin in it. And so they decided that they would check every single product before it comes in, reject everything, check it again on the way out to make sure. And so they said, well, we want you to create a prenatal vitamin for us that has all the nutrients that you know about, but we're going to make it clean. So we weren't shocked when this one passed because we've been doing the testing all along to know that it would be passing using the highest technology, mass spectrometers and such. We weren't shocked, but it was sad, because even some really high-end, high expensive, good quality companies didn't pass. And so again, you have to kind of know. So that's why we want to have this P2I seal of certification. So any company can check their products, any laboratory can get certified to be a tester as long as they follow the guidelines that have been put forth. And our hope is that this will be kind of like the ADA has on their toothpastes, or how other company, the USDA, symbol that shows up on foods that are organic. So our goal is to make it like that, so people will know. I mean, because even not just food-based products, but clothing and, bedding, flame retardants have all kinds of, obviously we don't want somebody catching on fire, but you got to be careful with them because there's forever chemicals in those. And, what do they treat the wood with on the crib and what's inside the mattress or the baby mattress, right? So we see expanding this not just to food-based products but also just life products in order to kind of make sure that people are just getting the healthiest thing. I mean, we live on a toxic planet, we do. I mean, there's, glyphosate, which is Roundup. I mean, there's people who live completely off the grid on the top of a mountain and they still have high levels in their body. So it's ubiquitous. I think we need to find a new planet. If you know of any, let me know, because we've already, find some remote island in the middle of the Atlantic that we can all move to. I'll just set up a little hospital there. But yeah, so it's a challenge. And the reality is, I don't think it's possible for all of us to completely minimize and completely get our toxins down to zero. But you know what? If we can cut it by 80%, we do have livers that are supposed to detoxify, but they're just the organ's overwhelmed.
And so that kind of gets me to my next question for you, because you can be afraid of every single potential toxin around you. But we obviously don't want to create too much fear, just awareness. What are some ways that people can kind of address it within their own bodies? Do you do detoxing as part of your practice? What do you recommend? I know that there's certain supplements that you can take to help pull some of these heavy metals out, but what are your key recommendations to help support the body's detoxification, and or if you found specific toxins or heavy metals that are directly related to a lot of these neurological conditions in children? Are there specific supplements or procedures that you recommend?
Yeah. So, first and foremost, identify where the toxins are and minimizing it, because you could do all the detox in the world, but it's kind of like bailing out a boat. You could be scooping it up, but if the water's coming over the side, you're still not going to get somewhere. So that still is the most important thing. Okay. But I use a lot of glutathione in my practice and N-acetylcysteine in my practice. For heavy metals, I'll do what's called a single dose chelation challenge test. you don't do this during pregnancy, where we'll give a one-time dose of a chelation medicine. Usually it's called DMSA. That's what's approved, FDA approved for lead removal. And we'll check a P beforehand and a P after you give a dose. And if you see a big jump the day after that wasn't there the day before, it meant the metals were in the body, but they weren't being peed out on their own, and that what you gave removed it. So you now can prove that the metal's in the body, and you can prove that that medicine works to remove it. So that's super helpful. But when we do that, we're not just giving that medicine. We're giving glutathione, we're giving NAC, we're giving B vitamins. We're supporting the system. We're making sure, because if you find the metal, then you use that same treatment over and over again in order to get it out. We typically do it in cycles, but you have to know that that DMSA can also pull good minerals out of your body. So on the days that we don't give the DMSA, for instance, we're giving them a multi-mineral product in order to replenish them. So there's all those things, and if you don't know what you're doing, you could probably mess somebody up. But if you know what you're doing, it's super safe.
Right. Right. Okay, thank you. And so anything non-vitamin D that you also, I mean, we talked about a little bit about diet, and I'm sure exercise is important, but before we circle back to vitamin D, is there anything else that you wanted to kind of throw out there as, with your years of practice and experience, as a holistic-minded pediatrician slash general doctor?
Yeah. Yeah. So, I mean, again, is why I spend so much time in what's your poop looking like and how you're sleeping. Okay. And so the sleep is the other really important part of that. Most people don't even realize that adolescents need more sleep than middle-aged kids do. But are you getting good sleep? And also, what is the quality of sleep? Are you sleeping all night long? Are you waking up? Are you restless and moving all over the place? Are you like, for me, when I sleep, I'm a mummy. I mean, like literally, I do not move 1 inch from the moment I fall asleep to I wake up. People have restless leg and are all over the place. They're not getting good quality sleep. So that's actually one of the first things, especially with a special needs kid. If I have sleep off, that's my first order of business.
Mm.
Not just for the family to get a little rest themselves, but also if you're not sleeping well, then nothing else is going to be working great for you. So that's obviously another really important part. And then, of course, how active are they? I mean, it doesn't mean that every kid's going to be on the track team, but what are they doing? Are they getting out and being active? Are they swimming? Are they biking? Of course, always wearing a helmet. And are they jumping on a trampoline? Or some kids are like, yeah, my kid bounces off is jumping off the couch all day long. Great. It's an activity, make sure that they have a good self landing space. So obviously that's important, but also mental health, because physical health falls apart if your mental health isn't good. So, so I check in. And in fact, even when the parent, like when with the family, and I always like ask the parents, like, how are you doing? Of which the parent then says, oh, no, he's doing good. I'm like, I didn't ask you that. How are you doing? Because, if a family, especially a mom, on a mental health perspective, if she's anxious all the time, if she's depressed all the time, if she's panicking, you can't offer the best care to your kid if you're in that hyper state. So I end up putting my social worker hat on a lot. I teach people mindfulness breathing. I talk to them about, maybe we do need to get you a therapist or to assess you a little bit more. You should be doing all these things that I'm talking about because a lot of those symptoms will go away. So that's part of the holistic with the W approach that we take, is just kind of looking at all of that, to take it into account, because it's all part of the one.
Yeah, great. I mean, stress itself can undo so many of the things that you're trying to do for your
Right.
health.
Absolutely.
It's a big topic. I'm glad we brought that up.
Yeah.
Um, so we're going to wrap up in a bit, but I wanted to ask you, have you run into any hurdles? I know you talked about other doctors being, really hesitant about the doses of vitamin D that you're giving to your patients, but um, what are some hurdles you think are in the way of having more doctors like you in terms of the vitamin D, not afraid of higher doses, being more aware of the importance of the serum level versus the dose? What is it that you think is holding so many people back? Is it just a lack of awareness? Is it a
It's a
fear?
lack of awareness. I think there's a certain amount of, if I didn't learn it in medical school, it can't possibly be true. Right. So, but I mean, are they going to medical conferences where they're talking about it? Right. Is it showing up on a board test so you have to study it? So some of those types of things would certainly be that type of barrier for it. And, I mean, let's face it, there are also just a lot of, granted, compared to 10, 20 years ago, I mean, like a lot of people now more know about vitamin D. I think COVID did a lot of that. I think COVID opened up a lot of people's eyes. And when the studies started coming up that showed that people with vitamin D levels about 50 or above 50 were much less likely to get hospitalized than people who weren't. So I think, it overall, I think it's more accepted now than it was 10 years ago, but not where we need it to be. But again, to a certain extent, it's weird for me because, since I'm here in this office, I don't really deal with many other doctors that are primary care. I have specialists, but for my cardiologist, my endocrinologist, I have holistically minded people that I'm referring to, so we're all on the same page. But of course, if you don't have the support team around, that can be really difficult. And of course, if someone lives in a rural town where there's only one pediatrician within 100 miles, if it's not that one, then good luck. So again, part of it is just integration and education in order for them to kind of, to get the word out there for it. But also, doing things like this, because let's face it, and this is also what happened during COVID. The parents, the consumers, they got ahead of the doctors. They learned that, so a lot of people, especially because COVID was so new, it's not like we had years of, that can't fall under if I didn't learn about it in medical school, can't be true, because we didn't learn about COVID during medical school because it wasn't around. So I think that it kind of empowered a lot of the families and younger people, especially, to realize that they may have to do their own research. Now, I want to make sure they're doing their own research, that it's getting credible sources. So one of the things that I always tell people, like, do your own research, but whatever you're doing, when you ask your question and you start researching it, put the word PubMed into your search. So PubMed is the National Institute of Health, the NIH. It's the library of every study that's ever been published. So it's not just things that are in like the Journal of the AMA, type of thing. Even like a little study in the middle of nowhere, if it's been done, it's there. So you can at least see if something's been done on it to see if there's any, I wouldn't say the word credibility, but anything that backs it up. So I think that's kind of a good filter for trying to self-educate as to what's out there. Somebody, I did a video on vitamin A that I released yesterday, and like somebody was like, how are you telling people to take vitamin A? Vitamin A causes cancer. I'm like, what? And so I looked it up. High doses of synthetic vitamin A taken for long periods of time can cause cancer. I'm talking about putting like recommended daily allowance vitamin A, and I'm using vitamin A for 2 days when I get exposure to any type. I know there's a lot of talk right now about vitamin A and measles. It's the only known treatment in the world for measles, according to the World Health Organization and the CDC. I find it's helpful to use those same doses on the first signs of any illness. So again, part of that's education. So I want to make sure that people are getting credible information, because there's a lot of misinformation out there. But that's also why I do my YouTube show. So my YouTube channel, which is drdavidmd, Dr. David MD. I have like almost 700 videos up there. And, but I'm talking about all of these types of things. So I kind of, hopefully it seems like people look to me as a good filter. Someone who keeps one foot in the mainstream world and one foot in the functional alternative world, but it kind of gives me a different point of view to be able to kind of filter those things out. So I don't find myself 100% aligned with either of those camps, but I'm like, I'm going to call it like I see it. I find that logic and reasoning and critical thinking can get you pretty far in life, but you have to have but critical thinking is really important, because sometimes I'm like, what you just proposed to me, that's not a possible thing that's happening.
Yeah.
Right. So it's kind of part of that too.
Yeah, yeah. And then when it comes just at looking at nutrient research, especially vitamin D research, you've got to know what to look for as well. There's a lot of bad research out there.
Right.
And that's one of the other things we at Grassroots Health do, is we educate about what are the specific guidelines that you should look for in a nutrient study. Did they measure the serum level? Did they give enough of a dose to make a difference? Are they looking at an outcome that, everybody who started in this study already has enough vitamin D, such as with bone health? So really
it's something I
important
did before you forget. So I did something that I'm sure you've said before. It's also important for health consumers to understand, if you have a really good vitamin D level, you do not need so much calcium. The recommended daily allowance is, I think they're assuming you're vitamin D deficient. So this 1,000 to 1,200 milligrams of calcium needed per day. If you have a good vitamin D level and you're taking that much, you may end up hypercalcemic. So what I do is for babies and such, since I know by the time they're a year and a half, they're going to have good vitamin D levels in my practice, I don't do more than 600 units of, milligrams of calcium per day. And for older people, the only time I ever hit that, go for that closer to 1,000 are adolescents during their growth spurts. And if you're pregnant or lactating. Otherwise, I'm not using it. I'm using somewhere between 60 to 80% of the recommended daily allowances. I don't want to hypercalcify somebody, because that can cause its own problems.
Right, right. And that's an important point that Dr. Coimbra brings up as well. So Dr. Coimbra treats autoimmune diseases, MS, with very high doses, therapeutic doses of vitamin D. So there's a difference there, right? We're talking, sometimes in the hundreds of thousands units a day, but he keeps an eye on the PTH and he also eliminates all calcium. But again, there's the therapeutic use of vitamin D, but we're not even talking therapeutic. We're talking about the physiologic like levels that we should be having. So there's a difference there. Uh, and since you're talking about calcium and you mentioned zinc, are there any other important co-nutrients that you often recommend? You mentioned vitamin K, but later on, any concerns with magnesium, anything else that you haven't covered yet?
No, I'm a big fan of magnesium. Unless you're intravenously giving magnesium, you can't really overdose somebody with them because they'll get loose stools before that happens to them. So you can do that. Works great for ticks and hyperactivity and for better sleep as well. I briefly commented as part of the test that I do, but I do believe every human being should know their MTHFR status and make sure that if they can't, obviously we all need folate, but if you can't activate folate to methylfolate, you better be on some. Most of the folate that's in our body is methylfolate form. Our body converts it over unless you have a mutation, a variant, I should say, in the MTHFR gene. But there's other genes that impact folate as well. There's an analogous one for vitamin B12. Can you methylate B12 to methyl B12? And if not, that's what a person can be taking. So I like to do like a methylation and nutritional genomic panel to kind of look at all of those types of things in order for me to again be more precision for the individual, that individualized approach.
Mhm. Yeah, love it. I could go on and on, but I
Yeah,
think
I know.
we've.
I think you and I could go for 3 hours. Yeah,
I
easily.
know. I wanted to ask a few more questions, but we're gonna end it with this today. Is there anything else you'd like to bring up? Any key takeaways, closing statements?
Yeah, I mean, the main thing is do your research and know what you're talking about. But it's unfortunate to say that, just because your doctor said, oh, we did a blood panel, it's fine. I'm like, they check vitamin D. Oh, I'm assuming they did. I'm like, do not assume that that's what they did as part of their blood panel. Okay. So go in to your doctor with a list of tests that you want to have done. Okay. And again, to some doctors, like, you're playing doctor, you're Googling things. I'm like, well, did you? you know, so being a self advocate, it's or advocate for your children because in our healthcare system, if you don't, you're going to get swept under the rug. So you have to be proactive about things and as knowledgeable as you can. It's like I feel like as if almost all the parents in my practice probably could pass the first year of medical school at this point because
That's
we're
great.
learning so much about this. I mean, I have patients who come in talking about B vitamin metabolism and biochemistry and stuff like that. I'm like, I'm sure that's not happening in most other pediatric offices, but they know that we can talk about it.
Yeah, and important too with the vitamin D testing. Yeah, if your doctor will do it, great. But follow up with, well, what was the number?
Right.
Because, not only are they not always willing to run the test, but when the test comes back, they're
Well,
often
they're
looking at
happy
the
with a 30. They're
wrong
happy with a 31.
range. Yeah, yeah.
Yeah, so
And
that's why
so
I
they'll
asked them, "Do you
tell
know
you
what your
you're
number was?"
okay.
Oh, they told me it was
But
normal. I'm like, I want to know your number.
exactly.
Contact that doctor and get to know what your number is. Do not accept because they probably are looking that there was no L by it,
Hmm. Yep,
to say it. But no, I mean, but
yep.
that's kind of, even not just for vitamin D, but I just figure for like even all the nutrients, if I tell people aim for the middle part of the reference range, and maybe this is a good another take home, you're not going to go wrong if you're in the middle of the range. So, for iron levels or whatever, if you aim for the middle of the range, nobody's going to have any problem for it.
Hmm. Keep in mind, though, with vitamin D, the range does change. It's interesting, even within state. For example, North Dakota, some hospitals, the recommended range is 20 to 50. And if you're over 50, oh, you're toxic. But
Right.
then you
Well, they're
go to a
pretty
different
dirty.
hospital over there and it's, 30 to 100.
Right.
We're talking, and our scientists recommend anywhere between 40 and 60 up to 80. Uh, Over 100 probably isn't really necessary unless you're doing, like I said, therapeutic vitamin D for specific treatments. But yeah, find out what that number is, whether you're testing through your doctor, testing through a home test, grassroots health. But, dosing to make sure you achieve that level. So retesting is important as well because everybody responds differently to dosing. And
Absolutely.
that's the final key point that I'd like to make, because it's important. You still, even with COVID, you see so many people talking about, so many more people talking about how important vitamin D is. But then you hear them say, "Oh, just go buy 1,000 or 2,000 IU supplement, and that's all you need a day." No,
No,
you've got to titrate to your personal dose, and it does so much good
yeah,
for the body, for everything.
it
Anyway,
does. Yep,
thank you very much,
absolutely. Thank
Dr.
you for
David.
having me on.
Well, enjoy the rest of your day, and we will see you again soon.
Thanks a lot.